your hair wasn't gray.
No, it wasn't.
Must have been in high school.
Yeah.
Yeah.
Okay, Lynn, do you want to get us started? I'll let people in as they join us, but I think we should get going.
All right. First order of business is to recognize the start of the meeting, and the bell will ring.
Hey, sounds like a bell.
Sounds just like it.
Okay, we're really lucky today. We have a great speaker, very knowledgeable, been around a long time with Rotary, and I'm going to let him explain the details. He'll explain exactly what the subject matter is and how it can affect and is constantly affecting us as we go through this dreadful pandemic. Ron Denham, just so everybody knows, you don't ask him about the weather because it's better than ours. He's in Toronto, so makes it easy to do speakers in this COVID condition we're in. So Ron didn't have to travel down here to join the meeting.
No.
Okay, Ron, I'll
Thanks
pass
very
it over
much,
to
Phil.
you.
Good, if you would.
And I will turn on the sharing for you. You should now be able to do
That's
that.
good. Okay, let me see. Yes, I can now. Thank
Yep.
you.
No problem.
Okay, let me just bring this up. Great. Well, thank you very much, Phil, fellow Rotarians, for the chance to talk to you about a significant new initiative, both in Rotary and in the other humanitarian world. In fact, close to 100 major organizations have come together recently and committed to address WASH in healthcare facilities, water, sanitation, and hygiene in healthcare facilities. And these 100 organizations have made a commitment of one kind or another. Some have committed money. WASRAG, the board of directors a couple of weeks ago, has committed WASRAG. Our commitment is really time and enthusiasm. Our commitment is to create awareness of this situation in the Rotary world and to encourage clubs to take action. Those of you who've been in Rotary a long time may remember past president Frank Devlin. His theme was create awareness, take action. That, in fact, is the commitment that WASRAG, or which is now WASH Rotary Action Group, has made to this particular cause. I'll just share with you at the beginning some images taken from the developing world. And the opportunities for Rotary, the opportunities for your club to work with clubs in the developing world is absolutely staggering when you see some of these images. These are the realities in some parts of the world. Overcrowded wards. Now, of course, we're getting close to that in COVID in some areas.
Yep.
Bottom right, a sink, dirty sink, not clean, no water available. Look at the top left, and the floor isn't even clean. You can understand how infection is rife under these conditions. Same here, water on the floor, nothing mopped up, dirty cloths, dirty towels, dirty cover on that gurney on the bed, and the same conditions to the right-hand side, appalling conditions. And that, believe it or not, was a toilet in one healthcare facility. Just a griddle, that's where people stand over there and poop. So this is the reality in many parts of the world. Billions of people are affected. 900, these numbers are staggering, you know. 900 million people have no water service at their healthcare facility. Healthcare facility is a hospital, a clinic, a nursing station, or something like that. Some publicly owned, some privately owned, some faith-owned. 900 million people. 1.5 billion have no sanitation, no toilets, no latrines. So open defecation is what is the consequence. Fewer than 25% have wash in the delivery room. You can imagine that. A woman going to deliver the child in the delivery room, no hot water, no clean water even to clean the baby, for the woman to clean herself after the delivery, or doctors to help her. No dedicated toilets for women. So during the menstrual period, there's nowhere for them to have privacy and freshen up, clean themselves. The toilets where they exist are filthy, with a foul smell, virtually unusable. In fact, so unpleasant that many people just decide they won't use a toilet. They'll go poop around the corner behind the bushes. 40% of these facilities have no hand hygiene at points of care. And think what that means in these days of COVID. One thing we're instructed to, requested to, exhorted to all the time is wash our hands. And when there's no hand hygiene, no safe water, no water and soap, no hand sanitizer, this is the reality. And of course, the consequences are disastrous. Patients and staff, everybody in the hospital are at risk of infection of one kind or another. And the poor hygiene causes water and hand-borne infections. 20% of infant mortality is due to unclean water. 1,200 children under 5 die each day, and 300,000 maternal deaths due to unclean facilities in places where women are delivering their child. In May this year, the World Health Assembly, which is representative of most of the nations in the United Nations, called for all member states to support access to safe water, sanitation, and hygiene, giving attention to the promotion of personal hygienic measures, i.e. hand washing particularly. Again, create awareness and take action and promote. And by 2030, 10 years from now, every healthcare facility to have safe drinking water for staff, for caregivers, for patients. Safe sanitation for all, toilets and latrines or something of that nature. Encouraging and facilitating frequent hand hygiene, i.e. we've got to hand washing facilities with soap, with water, and or with hand rub. Implementing regular cleaning and disinfecting of all parts of the hospital, not just the toilets and latrines, but the wards, the operating rooms, the floors, all surfaces and walls. Managing the excreta, feces and urine safely, and then safely manage healthcare waste, not just dumping it outside. This is a huge opportunity for Rotarians everywhere. In the developing world, Africa, India, Latin America, there are immediate opportunities for Rotarians. In a club such as yours, where you don't have some of these problems we've seen, it's an opportunity for you to identify and work with a Rotary club in the developing world to help support them in this mission. Another aspect of the program is to have better management and organization. One of the reasons for those conditions in many hospitals is the leadership in the hospital isn't concerned about these issues. Very often the hospital director throws up his hands, oh, damn it, I can't get water from the municipality. I don't have any funding. What can I do about it? Almost a feeling of despair. You need to have a cost recovery system so that we're generating funds, we're recovering our costs to be sustainable. Training leadership and management at all levels. Better technical and administrative support. We need to be sure that if anything happens to the water or the sanitation system, there's somebody there to fix it. And of course, administrative support, bookkeeping, and so forth. Educate and motivate towards water, sanitation, and hygiene goals. And effective monitoring and feedback. Unless we monitor what's happening, whenever we put in any healthcare program, any WASH program rather, we need to know that we're getting the outcomes we're looking for. Rotarians are already working in this area. Typically, some of the things we're doing, easy to maintain toilets and latrine. When I say easy to maintain, there are two kinds of latrines we'll often find in the developing world. Some are finished with a rough gray clay finish. It's troweled. It's not particularly inspiring. It's dirty. And we'll very often find that where that is the case, people are not going to spend a lot of time keeping it clean. You'll often get feces on the floor, not the same incentive to keep them clean. On the other hand, in some of the better hospitals, the latrines are finished with ceramic tile. Easy to keep clean, attractive, and it encourages people to keep it clean. They're installing hand washing stands, funding water systems, which includes filtration, storage tanks, cisterns, and the like. Appropriate technology, be it boreholes, wells, rainwater harvesting, what have you, whatever is needed to provide the water on a long-term basis. Cleaning protocols. Is there a regular schedule? Are people trained in how to clean the toilet, for example? Sounds obvious to those of us here, but if you've been in a community, in a culture where it was not necessary, it wasn't part of the rigorous procedure to clean the latrines every day, then we need to make sure it happens. We've got to provide protocols, schedules, and materials. Funding menstrual hygiene management programs and supplying materials. And rehabilitating water services. I see this word rehabilitate too often. It means that the initial investment was screwed up and it wasn't sustainable. But Rotarians are doing a lot of work. And this is some examples of Rotary project. You can see that clean ward on the left-hand side. At the top right, a toilet there with ceramic tile around it, how easy it is to keep clean. Below that, a VIP toilet with doors, clean, well-maintained. Here's hand washing station put in by the Rotary Club of Guatemala Sur. It's a Guatemala South Club in Guatemala City, and other wards. And on the right-hand side, there's an installation partly completed. But those are the kind of things that Rotary clubs are doing, and they're getting results. Now, what can we do about it? What can we in Rotary do about it? Well, the first thing when we engage in a healthcare program is to engage the local healthcare community. If you think of a hospital or a clinic, the chief guy there is invariably a medical director, or a very senior person is a medical director. And the purpose of the hospital is to help people get well, prevent them getting sick. So if we were to do a water sanitation project, we've got to get the medical and administrative staff on site to start with, as well as the local community around about it. Then together, not just Rotary, but together, identify what some of the gaps and assets are. Where is water missing? Is there hand washing? Is there water in the various points of various contact points, the wards, the maternity rooms, OR, and so forth? And then when we've identified what the gaps and the assets are, let's think of various possible solutions and programs. Don't immediately think of a borehole. It may be that the most appropriate solution is rainwater harvesting, catching the water on the roof and other surfaces, trapping it, capturing it in cisterns underneath the building or something like that. Think of all potential solutions. And when we look at these various solutions, let's agree with the healthcare professionals what are the priorities and what are targets, and then together, let's agree on the plan and the budget. And this commitment from the healthcare establishment and the staff is absolutely essential. If Rotary goes ahead and does something on its own, if the health community isn't engaged, then the likelihood they won't own it, it's not going to be sustainable.
True.
Let's also find partners for this, other Rotary clubs. And this, of course, is addressed to particularly to clubs in the developing world. We in Waterfront help them find international partners such as yours. Let's find donors, foundations, corporations. And I'm suggesting that they approach the WASH Rotary Action Group, because we've got all kinds of resources to help them. And advocate. This is something, we in Rotary have done very well at the level of polio. We fail to recognize that this is one of our greatest capabilities. Advocating, lobbying, call it what you will. Advocating for better funding. Advocating for a regular supply of water. Advocating for training of the people and so forth. Advocating for improvement. Rotary is so well qualified to take the lead. We have credibility around the world because of what we did in polio. Particularly important is that Rotarians are the community. Rotarians aren't an NGO coming from outside, doing something for a community, then leaving. Rotarians are part of a community. They have a vested interest in success. And they know if it doesn't succeed, if it's not sustainable, it's going to reflect on them personally. And very important, they understand local values and culture, and can be a real tripping point if we don't understand those issues. They've got contacts and relationships in the community. The Rotarians can bring in the powers that be, the mayor, the local municipalities, the higher level politicians at the regional or even the national level. By definition, Rotarians are prominent in business and professions. They're used to organizing and they've got the skills to lead change. In a club in Africa or India, they have global reach. They can get support from anywhere in the Rotary world, and they're used to collaborating and forming effective teams. WASRAG, the Water and Sanitation Rotary Action Group, can help. Some of the things we do, we've got assessment tools. So when a Rotary club goes into a hospital and they want to work with the staff to decide on what the priorities are, we have an assessment tool that was developed by Rotarians. It's been tested by Rotarians. It's based on a UNICEF model, very effective. We can provide expertise and resources to help plan the project. We have specialists in the WASRAG, the Professional Resources Group, some 40 Rotarians who are engaged professionally in some aspect of water, sanitation, and hygiene. They're available as volunteers, as we all are, to help plan a project. We'll help clubs identify international partner clubs and sources of funding. And you may see from time to time the WASRAG newsletter. Invariably in the newsletter, there are references there to clubs that are looking for international partners. But also on the website, if a club in any part of the world wants a partner, they will describe the project. It will go on the website. So if you go onto the website and click on projects, there you'll find clubs looking for support. We've got experts in preparing the application for a global grant. In fact, those of you tuning in later today, this evening, in fact, or tomorrow morning to the webinar, WASRAG webinar, will see the second set of sessions on preparing a global grant. The first one was held about a month ago, and that was on the community assessment. Today, it's on hardware and software, sustainability. And then the next one in early January is on monitoring and evaluation, all of which are important in preparing a global grant. We can assist in designing the monitoring and evaluation systems so that when a club and a community and a health care start out on a track to improve health benefits through water and sanitation, we can track it. Are fewer kids getting sick? Are mothers going home well, and so forth? We can help advocate for change at all political levels. And right now, Rotary clubs in Ghana and Uganda are involved to very significant programs, $4 million programs, jointly with USAID. And a substantial part of those programs are advocating for change, advocating for funding, particularly at all levels. And we can provide protocols for cleaning, operating facilities, how to do it. A simple schedule. This is what you do. These are the materials you need, how often you should do it, how you should do it, and so forth. So this is the role that WASRAG can play to help a club and a community get better access to safe water and sanitation. And I think that essentially summarizes what I would like to share with you. But now, anybody has questions?
What I'd say again when that next WASRAG, or whether, I don't know if it was WASRAG or beyond that, you mentioned something either coming today or tomorrow, a seminar we can join?
Yes, indeed. Yes, they're open seminars. It's a webinar. The first one is at 7 o'clock this evening. And that's for people who are in North America, or in let's say in our time zones, and also for people in India, Australia, and New Zealand. And the second one is at 11 o'clock tomorrow morning. Essentially, the second one is a repeat of the first one. So we, in fact, can reach Rotarians everywhere. Just if you go to the WASRAG website, www.wasrag.org, you will see there the list of these webinars, and click on, and then you can come in. They're well attended. The last one had about 400 members. So far today, we have, I think, about 700, today and tomorrow, 700 registered. We usually get about half of that number. That seems to be norm on webinars, but everybody is welcome to join.
Bill, over to Ron.
Yeah.
Actually, I'm registered for that seminar this evening, and I was on it the one as you just referenced about a month ago, and I will attest to the fact that they're just excellent webinars.
Thanks, Barry.
So can we still watch the previous one?
Yes, they
Good.
are. They are on the website.
Good. Well, just so you know, this talk you gave today will be on our library of speakers, either later today or tomorrow morning. So you can refer yourself to this club and its speakers and to view your talk today.
That's great, Phil. Thank you very much, because there are a lot of people who, we have a lot of Rotary ambassadors around the world who are giving talks to clubs, and they love to have not just the presentation, which they do have, but also the narrative that goes with it.
Right.
So I will listen to myself, and if I find I was making sense, then I will forward the whole package to these other people so they can use it directly.
Yes.
Well, Phil, over again to Ron.
Yeah.
There's no question about it. Ron is the Rotary International guru when it comes to the topic that he's presenting to us here today. And I'm so pleased to have seen that he's designated as emeritus. And he's got the right color of hair to go with that term, I might note.
Yeah. I still have some hair.
I just like to ask further. So last Thursday, I was on a webinar. Maybe it was, it was Zoom platform, and Rotary International past president Ian Risley was speaking, and there were just short of 500 on that one.
Mm-hmm. That's right.
And
that was good.
he was speaking to the new area of focus on the environment.
Yes.
So can you just explain? It's going to become official on the platform next July, as I understand it. So can you explain the cross connects to this new area of focus?
Yeah. Well, as you know, there are right now there are 6 areas of focus, and that will be the 7th. The areas of focus include basic education and literacy, maternal and child health, another one, health and disease prevention, peace, water, sanitation and hygiene, and community development, community neighborhood development, something about community development. Anyway, and each RAG is comprised of people such as myself with a passion and an interest in some aspect of activity. But increasingly, when a Rotary Club wants to engage in a program such as washing schools or this washing healthcare facilities, you can see immediately a need for RAGs to come together. We have put together, in fact, this presentation you've just seen results from input from WASH, or from WASH RAG, also maternal and child health, and they were the 2 major participants. And then some of the later developments were also including the health and disease prevention. So 3 RAGs coming together. Unfortunately, Rotary isn't yet organized to cope with these cross sections. So whenever anybody's doing a global grant, they have to say it is primarily a WASH, or it is maternal and child health, or something like that. But basically, the RAGs are working together. Now, coming back to the environmental, here there's I wouldn't say there's well, yes, there's an overlap. Because water, sanitation and hygiene, our RAG, and if you look at the area of focus, it does include water resources. Water resources and some of the programs that in WASH RAG under water resources, including cleaning up the rivers. There's a very big program in cleaning up the Mississippi right now, cleaning up rivers in northern Mexico, cleaning up the littoral in northern, get rid of plastic soup and so forth. And those, they're also environmental, but we don't have a problem. It's really a question of, and after all, in Rotary, everything is driven by a club. It's what a club wants to do and how they see that initiative. If they see something to do with, let's say, river cleanup, it's part of WASH RAG, we'll help them. If they see it's more on the environmental side, then they'll get help from the environmental Rotary Action Group. But as you said, Barry, that session last week was very good, and their initial emphasis is very much on tree planting, which is essential for the preservation of the environment. But this area of river cleanup and so forth, watershed management, which is part of the Water and Sanitation Rotary Action Group, could very easily be seen as a program for somebody in the environmental sustainability group. We don't have a problem with that. Let's, there's so many challenges out there that we don't need to worry about turf. Let's all go and fix the problems such as they are, and they're getting worse all the time.
I have Phil, if you can give me a couple of minutes, I have a personal story and observation
Sure. Do you need to share?
into this program for today. I was born and raised on a farm near Bay City. And that was between the years of 1941 and the comment that I would generally make is we did not have what was recognized as indoor plumbing until 1954. So your presentation showed a couple of different situations for latrine kind of living. So I lived with, in my mind even then, somewhat primitive circumstances. But there's a lot more to one individual than that person's influence on the environment. And so here's the relationship. One of the things that I was involved in was relocating the little half moon house that used to provide for some thought to be shelter from the elements. But from that, the environment was affected in a lot of ways that until even recently, I hadn't really considered very much. And that is what happens within the earth when that kind of a situation exists. Now, I'm talking about one farm family of 4 people on a 100-acre piece of property. When you look at a community in some other location and they're combining all of the stuff, what is the ultimate effect of that? And certainly along about 1970, give or take a few years, my parents found that the cistern well under their house was being affected by what they thought, and it probably was to some extent, affected by the outhouse on the Stand Ridge 100 yards away from the house.
Yep.
When that came to pass, then they changed to a cistern for water, for potable water, which had to be hauled,
yeah,
and which they had to pay for, obviously, for somebody with a tank that could go to the city and draw city water and put it in the cistern so they could use it for a month, and so on. When I think about some of the projects that might exist out there for water sanitation, and I look back to a single point of reference myself, it's almost overwhelming to think that that you can go into a village of, I don't care what the number is, 100 people, 200 people, and capture all of the elements that go into safeguarding those people from themselves.
Mm-hmm.
And I realize that's what we're all about, advocating to do that. But now you're telling me that there are 90 million people that are in some fashion relating to that circumstance. And that is, in my mind, almost overwhelming.
Mm.
think you have to do something, but I'm not sure what that something really is that will have a significant impact. Now, one last comment I'd like to make is water is free, but keeping it safe is not.
Yeah.
So if you can collect rainwater, I believe that is probably the best source of finding water to use for sanitation purposes. I don't know how that fits into the whole program here, but those are just some comments to think about because every single person have an impact on water sanitation and health.
Yep, we could go on for a long time, Lynn, about this, but coming back to your earlier observations about living on a farm. One year I was the president's representative to a district conference down in South Texas, Brownsville, Corpus Christi, Laredo. And down there, these developers are building what they call colonias. These are taking the land, dividing it into plots, and each house has a well and a septic tank. Unfortunately, the lots are not big enough, and some of the effluent from the septic tanks is polluting the water system, and there's an incredibly high incidence of tuberculosis and other diseases down there. Now, that's maybe, so I'd say, a fault of the capitalist system that we have. When you, and it can happen in Ontario, in fact, Barry may remember this in, was it Waterton, pig shit got into the water system and people were killed. It was terrible. That was because people did not do their job. They weren't monitoring it. They were doctoring the readings and so forth. When you get to these large situations in the developing world, a very important part of delivering a, let's say, a pit latrine, which is quite common, is the means and funding to clean it from time to time. You got to empty it. Now, some may have a septic tank, but in many cases, it's just a pit latrine, 4 meters deep, you know, deep, and it'll last for maybe, at a household level, maybe 3 or 4 years. But it's the same at schools. They've got to have a means of emptying it. And I got a terrible letter about a year ago from a Rotary club in just outside Kampala in Uganda. And this was a notice that had been given to a school. This school was threatened with closure because they did have pit latrines, and nobody knew how to empty them. They didn't have the means to empty them. So now the latrines were full, they were overflowing. The stench was such, nobody was using it. And the local council said to the school, we are going to close you down unless you do something about it. Now, whoever had given that latrine to the school initially was clearly at fault. They hadn't thought about the training and the instruction and the behavior change that went with it, nor how to raise money to keep it clean. But these are some of the issues. So one of the topics you're going to hear about at this webinar tonight is the whole question of software. Rotarians are very good at hardware, building, putting in a borehole, digging a well, installing rainwater harvesting, building latrines and toilets of various kinds, putting in pipelines. But too often we ignore what we call the software, the building capacity at the local level, getting involved in the behavior change. For example, if we introduce a hand washing system to a school or anywhere else, people have to be taught how to use it. You know, if you're not doing hand washing regularly, they don't know how to use the water and the soap, how to do it. So very often in school, it means we put that into the curriculum. So it's become part of the formal training and so forth. So this software, the changing the habits with toilets and latrines, the whole question of cleaning them becomes absolutely critical if we want people to use them. If we, I've seen toilets which started out well, but I would look into them and feces on the floor. They just haven't been swept up. Clearly, that doesn't encourage people to use the toilet. They'll go behind the bush somewhere and practice open defecation. So we have huge, I'd say the issues are more cultural and attitudinal than they are in terms of hardware and infrastructure. Don't get me going.
Well, I'm going to make an additional comment, Ron. Yes, Lynn, I grew up on a farm in southern Montreal, and the indoor plumbing came in 1953.
Mm-hmm.
I can well remember that. And I always remember my grandmother, even though there was indoor plumbing, she always, to her death at age 91, went to the outside.
Yep. Mhm.
And it literally was the Eaton's catalog. What I want to comment, Carolyn's sitting beside me here. We've been in El Salvador and Guatemala and Honduras. I can still remember going to a school in Honduras, and they had latrines, but nobody was using them. And I went over, walked around a bit, and they were actually going over to the edge of the hill, and that's where everything went.
Yeah.
And just really unfortunate. But you know, the kids were all happy, but what you don't know sometimes doesn't hurt you. But there's I don't know who built those latrines, but they weren't being looked after, just as you were just saying, Ron. So my point is, conditions that you outlined at the front end of your presentation are very real.
Yes. Yeah. Thanks very much, Barry. So true.
Any more
In
questions?
the matter
folks?
of potable water, there's more water in the ground than there are in lakes and rivers. I suppose you have to find out if the land you're in has a water table that's usable. But the extraordinary amount of more than all the lakes and rivers of the world are for potable water is in groundwater.
Exactly. Oh, that's right. In fact, and this is a sideline, but one of the largest aquifers, believe it or not, is under the Sahara Desert. And if you want to read a bit about this, go to a website, go to the Great Man-Made River. The Great Man-Made River was a huge project of Gaddafi's. It consists of 3 4-meter diameter steel pipes, which are bringing water from under the Sahara at a depth of roughly 300, 400 meters, 1,000 feet down. And this is bringing water to the Mediterranean. So virtually all of the Mediterranean area of Libya is dependent on water from under the Sahara. At the present rate, it will last for 1,000 years. But if industrial development continues, it might be depleted in 100 years, because clearly it's not being recharged. There's no rain to recharge that aquifer at the present time. But you're right, groundwater, and that's why boreholes are such an important part of Rotary application around the world, tapping into that groundwater. Yeah.
Okay, folks, any more questions?
Okay.
Tell you, I have a friend just around the corner who at age 60 joined the Peace Corps and went to Lesotho and lived for 2 years in a hut. You got to the town finally by horseback. They did not have a road. And she helped them, whatever it was. She returned to the United States. She and her sister then returned to Lesotho with $20,000 and found somebody to bring spring water to the town. So children and everybody else had clean water and therefore less disease. What an amazing woman.
Yeah, that's right. The history books and the narratives are filled with stories like that, and it is so impressive what individuals are doing. And a lot of work is done through churches too, faith-based organizations. The only downside is that occasionally they don't think about what resources will be needed to sustain that.
There you go.
Putting in a borehole or something like that, maybe after 3 years, if it's a submersible pump might need replacing, or something breaks on the hand pump. If there aren't resources to fix it, if there isn't a supply chain for spare parts, if there aren't technicians skilled, then you'll find it falling into disuse. And quite frankly, the rate of non-functionality is appalling. Anywhere between 50 and 70% of water projects are non-functional after 5 years.
5 years.
Wow.
I saw some numbers the other day. $1.2 billion has been wasted.
Good, good.
$1.4 billion have been invested in water and sanitation facilities that are no longer functioning.
Ron, when you gave your presentation, the only word that I thought was missing is sustainability. And the reason is exactly what you're talking about. You told people to plan, you told them to check with the neighborhood. You did everything, but you kind of stopped of, well, is it going to be anything worth anything next year? So I would suggest putting that word in.
Thank you very much. I will. Yeah,
So true.
It's funny that I left it out because the webinar today and tomorrow.
I know you always think about that, so.
Yeah, thank you very much, Linda.
By the way, Ron, Linda's a teacher.
Okay, good. Yeah, you've got a good student here, Linda. Thank you.
Oh, good. You're doing great. I love it.
Okay, well, Phil, thank you very much for this opportunity to spread the word.
No problem. It was great. Absolutely fantastic.
Yeah, and if as and when your club wants to get engaged with another club, let me know. And Barry knows how to get hold of me, but you all do now. So
I do now.
Yeah, great. Thank you again. Have a great day, everybody.
Okay, Lynn, I'm going to pass it over to you to end the meeting.
All right, sir. As we close out all of our meetings, we participate in the four-way test. You may read it. I'm not coming big screen, but anyway, most of us are Rotarian here today, so you'll know what it is. But the four-way test of the things we think, say, or do.
First,
Is
is
it
it the truth?
Second
is fair to all concerned.
Third,
Third, will it build goodwill and
build goodwill.
cross-talking?
And fourth, will it be
Beneficial to all concerned.
So the test is almost passed. Anyway, thank you all for being here this morning, and meeting is ended.
Thank you.
Thank you.
Thank you all. Thanks
Good
for
day.
coming.
I know.
Thank you.